So good afternoon, everyone. Welcome to our fourth webinar of Cancer Power Circle. Just a quick introduction. We are Patients Engage. We are an online platform operational for over 5 years, focused on holistic and evidence-based management of chronic conditions, and cancer is a significant one as well. We believe in the value of lived experiences and how it is important to look at care from the perspective of patients and family caregivers, and how when you are more informed and engaged with your own health, you feel more empowered and you're able to get to a better quality of life. We've been doing content on the platform for, as I said, for over 5 years, but we've also been started webinars, and in the last few months we've really increased the focus on these webinars based on the feedback we have received. We've done a wide range of topics, and through Cancer Power Circle we are trying to reach patients, survivors and caregivers who would want to engage and understand issues specifically around survivorship, which are challenging and often not talked about. So in the recent times, we've talked about breast cancer during COVID. We've talked about managing lymphedema. We've had survivor talk about giving up tobacco because of oral cancer and how he's a passionate advocate now. We had a doctor talking about dental rehab. And today we are here to talk to two bladder cancer survivors, and how you will see how each of them in their journeys have uh, been better informed and empowered themselves to live productive lives and to deal with the challenges. We also have with us a psycho-oncologist. So let me do a quick introduction of each of them. We will first start with Shraddha. Shraddha is a bladder cancer survivor who brings a very unique perspective to this conversation, where she talks about her challenges, but also how she does not let it affect her, her quality of life. Bincy is a psycho-oncologist, and she will talk about how persons with ostomy bags, urostomy bags, etc., can cope with these with the psychosocial impact of having their lifestyle changed, their perspective changed. And we also have Mr. Uday Kerwar, who is the chairman of Ostomy Association of India. He's also a bladder cancer survivor, I think for about 20 years. And we have a team of moderators, Urvi, who is herself a breast cancer survivor, Dr. Sheetal Patel, who has been associated and worked with Patients Engage for, I think, pretty much since its inception, and is also been a caregiver to a cancer patient. And I'm Aparna. I'm the founder of Patients Engage. Just a guidance to the attendees. This session is being recorded. It will be put up on YouTube, which is why we typically, at least for the first part, we do not take in voice questions. And so please post your questions on the Q&A. And if you wish to, you can introduce yourself in the Q&A as well. And if you're on Facebook, again, because we are particular about privacy, only the first, kind of the formal agenda will be streamed. When we switch to just an open discussion, that will not be streamed. So join the Facebook group Cancer Power Circle if you are a cancer patient, survivor, or caregiver. And you can always write to us at editor@patientsengage.com. Again, our usual social media handles. We are on patientsengage.com. We are on Facebook, Twitter, Instagram, and YouTube. So I will not take too much of everyone's time. Let me go straight into the discussion. And we are streaming and we are recording. So Urvi and Shraddha, over to you, and I will go off video.
Okay. So good evening, everyone, and welcome Shraddha Shah, who is a urinary bladder cancer survivor. Welcome, Shraddha ji.
Thank you, Rohit.
Yeah. So let us go to the day you were diagnosed. So when did you first get diagnosed?
Uh, I say a few lines about me.
Sure.
I'm a aromatherapist, been working for last 32 years. I have taken my degree from Switzerland, my postgraduate diploma, and in 2014, around last week of June, I just went to the washroom, and my pot was full of blood, and it sounded really alarming. So I called my family, and then we decided to call doctor, and I was suggested to go for KUB sonography immediately, and went for it. Went to see my doctor, who was my best friend, with the reports. And like looking at the report, he was like, oh, oh my God. And I was sitting and looking at him, and I realized something is not good, but never thought of this kind of thing, And he sounded really worried. So I said, please, whatever is there, talk straight, no ifs and buts. And he told me, because I was all by myself, I went to see him. So he said, it's cancer. And it was a pause from my side. And then I asked him, it is life changing or life threatening? He said, don't want to cry? I go, no, let's find out what it is and let's start acting. And so things were on from day one. And other appointments for CT scan, and then uro-oncologist, and there he suggested that we have to scrape this tumor, and it was positive right from day one, 100% positive, and only urinary bladder cancer. So things were ruled out. Okay, you don't have to go here and there, just straight to the uro-oncologist. And appointments were set up, since my friends were doctors and involved very actively. Path was little smooth, that and you don't have to wait for anything, just go straight. And the plan of treatment was decided there.
Okay. And that was the time you were told that you are going to get a urostomy?
No. See, urostomy is a later part. The first you have to scrape the tumor and get more investigation should be done, and find out what is the stage, what is the condition, and how is the tumor. So mine was only first stage, but it was not metastasis. The fortunate part was it was first stage and not metastasis. But the unfortunate thing was it was a high grade tumor. So, what is high grade tumor? It has a tendency of reoccurrence. And in my case, it was more than 50-60%. So that was little unfortunate part. And then I had very good friends who were into this field: oncology, hematology, urology, cardiology. So we made a kind of syndicate and started meeting at my place. So at night we decided, okay, first let's go for this scraping, and then the second part of the treatment was, okay, you have to take BCG chemo kind of thing, that they introduce strong medication like chemotherapy they use, and through vagina they inject into urinary bladder. Yeah, and yeah, I had to take 6 rounds once a week each, and that was a hell of a time. It was really troublesome, extremely painful. And I used to get 104, 105 degree of temperature. So it was a killer, lots of vaginal pain, and with the fever, body ache, whatnot, So that was, I think, it was the most difficult time. I was in real hell of a pain, and I just wanted. So 6 rounds, one by one, I finished, and couldn't eat. See, my tendency with the food is, even with the smallest illness, I cannot eat. I have to go with semi-solid or liquid food, but I cannot have solids. So I was losing weight, and was not getting better the way I should. And by the third week of October, my all this treatment was done. And then I had a program that every month I have to go for blood work as well as sonography. Every month I had to fix the date. So it was the 5th, the October, November, December, then come the April. And every time it was so traumatic that, oh my God, hoga? No, but there. Every month when you see the report, there was lots of anxiety and stress that, I don't want this to happen. And in April sonography, it was back again. So yeah, it came second time, just in span of 6 months, where my doctors, all my surgeon, and everybody was hoping that with my health condition, at least I will have a period of 3 to 5 years. Instead, yeah, it just came back in 6 months. So again, that meeting started. If you have a second time this kind of bladder tumor, you can take second round of BCG treatment. If third time, you can take third time, and then if it comes fourth time, you have to go for urostomy.
So
So
tell
with
me,
my
continue.
so with my condition, it just happened in 6 months. So when we met, we had a discussion. So I asked my friends, what is urostomy? What is different? And what, how it can change my life. So I was fully aware of each and every detail. But then we had a discussion with my family, my children, my husband. And there I told them that I don't want to face that BCG treatment once again. It was hell of a time. And then also after that, you are under stress all the time, because every month you have to go for the sonography and blood work and wait for the report. So instead of my doctor telling me, I told him that I want to go for urostomy. And he completely disagreed. No. You can't decide. This is my decision. We have to take another chance. Everybody was like, they don't lose your organ. It was losing organs.
Yes.
But I was not ready for it.
Right.
So it was easier in a way. Yeah, I decided it.
Right. What was your biggest challenge with the stoma? Like, how did you manage your nights and all?
So, surgery was big, 7-8 hours surgery, then 2 weeks of hospitalization, recovery, small recovery there. So there things were taken care of by sisters and nurses and staff. So you don't realize what actually you are into.
Right.
After discharge, we came back home. So here there was a situation that there should be somebody to teach you how to handle stoma.
Right.
So there was nobody. So when we came back home, the same night, middle of the night, my dressing came off. And we were not given any knowledge about it. We had no accessory to do dressing and nothing. My husband at middle of the night went to 3 hospitals to seek for the help. But nobody knew how to do this. So once again we contacted the hospital and they sent us help around 12 o'clock in the night and he did our dressing. That's where we realized, okay, we are in big situation. It's not easy. The stoma handling is not easy. But then I got one address. There was a nurse who used to do this dressing. So I contacted all my friends, and then from abroad, I got all the accessories for dressing needed, and we started handling things. But with stoma, there's lots of changes in my life. It can go anytime off. No pattern as such in the beginning. Even middle of the night you wake up and everything is wet, your sheets and your clothes and everything, and then you have to go to shower, change everything, and then my husband used to do dressing on me.
So how did you cope with all those challenges like initially?
Initially it was very challenging. Sometime I was wondering, okay, the decision which I have taken, it was my decision. Was it correct or not? Because it was, we couldn't think of any other thing than stoma, how this is going to react me next. But it took 6 to 8 weeks to get adjusted to stoma. But then things were little easy. But then sleeping pattern that you have to sleep in this straight. You can't sleep sideways. Otherwise, it will come off easily. So started finding out things. You shouldn't bend down. You shouldn't sit on the floor. You shouldn't wet it during your shower. So slowly start picking up things. Start asking my friends and doctors, guide me with this. Then one of my friend who is urologist, neurosurgeon in UK, he made a video call for me with a stoma sister. And then things were really comfortable. And my husband learned wonderful way of doing dressing. Things were little okay.
Yeah. So medical support is one thing. Another thing is emotional support. So who provided you with the emotional support?
Everyone. To be very honest, everyone. See, there are two types. Patients, if you are crybaby, nobody will come close to you. They will be sympathetic for day, 2 or week or month time, right? But I had acceptance right from the moment I knew this. Because you have to deal with this, whatever has come to your kitty. So fine, do it with bravery, do it whatever challenge is there, patiently, and then only you can find out the correct way. Yeah, you have to find out the ways. So that my approach helped me a lot. So my family, my husband was all the time with me, sharing my room. And in month of May, no AC on, no fan on, and he was perspiring and I was sleeping. Like, but he was there all the time. My children, my daughter has done her PhD in cancer drugs research. So she was all the time searching for how they can make my life more easier and comfortable. They were constantly on phone. But the biggest help I found with my son, he was at Bombay, but during his lunch hours, he will call me every day. And slowly, like a mother teaches a baby, he started teaching me. take a walk, sit, listen to music, what you have eaten. Oh, let's have something more. You know, those small things, he will always find out something. Let's do this. Let's stairs, step up the stairs. 4, 5, come on, one more. You know, those gave me the confidence because I had lost 11 kgs of weight. That was, yeah, that was big loss. So immunity and energy was really a big question for me. And yeah, and friends also very supportive. My immediate family, my relatives, all were supportive. But you know, in beginning, very few people knew about this because I wanted to recover my way, my space. I always stay that way. When I'm sick, I'm in the corner. I'm all by myself. That's how I enjoy. So
Yeah.
this time also, I kept it that way.
Alright. But has your social life changed after the urostomy or after the treatment?
Yeah, tremendous changes are there because in two ways. Uh, like I have to take care of certain position. Even the timings I have to take care of. I cannot go out just like that because when I started socializing, I used to come back with the infection home. So I was little scared of going to big events like weddings, like theater, like halls. So I started with the small groups, 2 friends, 4, 8, like that. So my exposure will not give me something back. At least I have gone for pleasure outside. So I want to be happy when I'm at home. I don't want to fall down with headaches or nausea or infections, fevers. You know, I used to get it very frequently. So slowly, uh, I started meeting people, and some of them were very concerned about my illness, my situation. But in the beginning, not everybody used to understand. See, I need some space differently. I have to sit in particular position. I have to, I need some help, like help me. I need to go up. And but most of the time, people were very friends, were very helping, and I used to hang around with the friends or family who can understand my situation because I don't want to be burden on anybody. So that was this is my problem and I have to deal with it like that. But then there were times that people may not understand your requirement because I had special needs every moment. There was something, right? I couldn't drive for more than 20 minutes because after 25, 30 minutes, I have to empty my bag or I have to take big bag. So I need particular space. I have to sit at the right corner. So those things it took little time for my friends, my relatives to understand, but they were more or less very genuine with me. And some of them were like, there are people. Sometimes they find, "Arey yaar, she will be responsibility. Stay, let's not take chance with her health." Those kind of things. They were concerned. Say anything, and she might fall sick like that. But more or less I was just fine. And I had also taken all baby steps. Like I'll go slowly with 2 people, then 4 people, then more people, and I was traveling also. So no
Yeah,
worries.
yeah. So, what precautions do you take while traveling by road and by air both?
See, if I have to go by road, then if I am driving, my window is of 20 minutes, 25 minutes max,
Okay.
because then I have to empty my bag. So I have to have stop. So if it's heavy traffic time, I will not dare to go out. If I'm stuck up, then what can I do? Then slowly I learned that I can keep one bottle, empty bottle, the small water bottles, disposables. In case of emergency, I can empty my bag and I can gain 25 more minutes because it happened once. I was stuck up and there was no way I can get out of the car. So I was in middle lanes. I cannot open and get out of the car. And what to do? And that time I got the idea that I should keep this way. At least I have some more time.
Right.
And if so, and if someone else is driving, I have no issues. I take my bag, uh, which is a urine container bag. It has a capacity of 1800 ml. So it can collect up to 1800 ml, and it is so uniquely designed that there is no smell even after 1800 ml and 10 hours of time. You keep it for 2 days like that without washing, there won't be a smell. So it's so fantastically designed. My friends has given it a name. It's a perfume bag. They call it a perfume bag. So we laugh it off. Hey, keep your perfume bag safely. Because I will like that. Now you can take it in manner you want. And if I have to travel by air, then I need a wheelchair. I cannot, because it's a long walk I can do, but then there are long queues, and there I cannot empty it. And secondly, it has a water in it, so airline people don't understand, or because they are not all very highly educated that. This is what it is. So it's water. Oh, you have to empty this, come to the side, because they don't allow more
They're
than
not
30
aware
ml of
about.
liquid. Yeah.
Mm.
So then, and if I'm in wheelchair, things are very smooth and easy. So I have opted for wheelchair, even though I can walk. I will not dare to walk. There's lots of people around, and I don't want to get infected. But whenever I have long flights, next time I'm down with something. It is regular thing, because the close environment and maybe tiredness,
Right.
sleepless nights happens. But it's okay. I'm okay with that.
So thank you so much. I'm done with my questions. If Aparna and Sheetal want to ask anything.
Yeah, I think just one question on your travel before, but we will leave the Q&A for later. But just one question on your travel is, do you carry a doctor's certificate as well?
Yes, I do. Always. I have three of kind.
Mm.
Nobody understands, nobody reads, and they are not ready to even look at it. So, with the experience, I have learned it. Don't show them, don't say a thing, sit in the wheelchair. Many times they ask me to take off your this bag attached to stoma.
Mm.
How can I do that, right? But they ask me to. So I
Mm.
make them understand that this time you have to call a doctor. I cannot do it, you cannot do it. Please call a doctor.
Mm.
And finally, they gave in and let me go. So this
Right.
is a process I have to face all the time.
Right.
Yeah.
Okay.
But I will there are people listening to, so I will suggest, I have two things to tell with my journey, that please be patient whatever situation you are in, and cancer is not always a cancer. Lots of research has been done, so be patient and things falls in its place. It's just a little longer, tedious and painful treatment, but you can always win out there. Thank you.
Right. Thank you, Shraddha. And I really like your line that you shared in your interview where you said that, it is another beginning.
Yeah,
So,
it is. This is my second life,
right.
and I am enjoying it at fullest.
Right.
No schedule, no timetable, just enjoy.
Right. Okay. So thank you, Shraddha, for sharing your experience. And I'm sure, first of all, it was full of information, but also I think your spirit is truly indomitable. So I think but we will come back to you after the next session for any Q&A, right? So thanks,
Yeah.
Shraddha, and thanks,
Thank
Urvi.
Thank you
you.
for now. Yep. Bye.
Bye. No, don't buy, but just, yeah, you can go off video for now. Yeah. So let us now get to Bincy and Uday. Let me start with you, Uday. Just a couple of quick questions on your background as a bladder cancer survivor as well, if you would like to just do a quick introduction about that.
Well, uh, like she said, the same symptoms prevailed here. I was getting blood in the urine, and my family doctor was a homeopath. So
Mm,
I was asking him, and he said, "You drink water
mm,
and see what happens." So I used to drink a lot of water. The color would go back to normal.
mm.
So this went on for about a year.
Wow.
Then after a year, I thought better it is I check myself out. So I was advised to do a scan. I did a scan in which it was noticed.
Mm,
Growth in the bladder was noticed. Then I was suggested I should do a cystoscopy.
mm,
So they did a cystoscopy on me, and they said it is malignant, and I was advised a medication, and it like she said it's a 6 week course. So I was given that course, and I completed 6 weeks, and they did a second cystoscopy to find out what has happened.
mm,
And in the second cystoscopy, they found that it's not there.
mm,
So I was given the all clear signal, and I was very happy that it's gone
mm.
because the doctor he called my wife in the OT and showed her on the screen saying that see this is the inside of his bladder. There is no
Mm,
growth.
mm,
And I was given the all clear, and I went home and I joined duty, and everything was fine. But then I found that I'm putting on a lot of weight,
mm,
literally.
mm.
I had to actually alter my trousers at least 3 times in the next 6 weeks.
Wow.
I was really putting on a lot of weight,
Mm,
and my ankles were getting swollen.
mm,
And then one day I couldn't breathe very easily in the night, so we went to the hospital, and there the surgeon told me that you have a growth. I said the growth is not there. He says no, the growth is there. How did he not see it? So
mm.
the urologist was called, and he said it is not there. Then they took another scan, and they said it is there, but it was on the outer wall of the bladder, and he was looking inside.
Okay.
So they did a third cystoscopy, and they said again it's malignant. And this time they put stents, and I was having water retention in the body. I think some 8 kg water was there in the body. So for 10 days I was hospitalized, and the water was drained out.
Mm,
And then I was told that unless we open, we can't tell whether it can be saved or not. So we said, okay. I prefer to go to Bombay. I went to Tata's, and I did my surgery there. Had my surgery done in Tata. So there, they told me the same thing. The Dr. Kulkarni told me the same thing. He said we have to open up and see, and if it can be saved, I'll save it. Otherwise, I'll have to knock it out. So finally, he opened me up, and I believe he couldn't save it because I believe the infection had gone to the nodes.
mm,
And I'm not too sure how many stages are there, but I think I was on stage 4. So
mm,
he said it's it's a dicey situation. We don't know how long, but he said if it has to come again, it'll come in 2 years' time, within two
mm,
years. Otherwise, chances are low of it coming again after that. So I was on parole for about 2 years,
mm.
and it didn't come again. And I was doing my every 6 monthly scan, pelvic scan. I was doing, and then he made it yearly. So now I'm doing annually the scan. It's not come. It's not come again.
Mm. Okay.
Life goes on.
Right. Right. Okay. And any based on you now also are chairman of Ostomy Association of India, right? So if you can just again do a quick, introduce that to people who are not from or who may not be aware of this organization and what services does it offer?
The Ostomy Association of India, or OAI as we know it, has been was founded way back in 1975
Hmm.
by none other than Dr. I forget his name. Yeah, nowadays I keep forgetting the things. Jasawala, Dr. Jasawala, the famous Dr. Jasawala, the first oncologist of India.
Right.
He's the one who founded the Indian Cancer Society, and he's the one who founded our organization. And with him, there were two other people. One was one was Ramakant Shah, another one, and there was Dr. Narang. Now, Mr. Shah was the person who really was the power behind running of his organization, because he gave away his existing business to his brother and did full time only this, because he was himself a colostomy patient. And but Dr. Jasawala gave us sufficient backing, and we functioned very well. And since 75, we are there. What we do is we basically give pre and post op counseling. And one of the basic things is when the patient is told that he's got cancer,
Mm.
it's the patient and his family both go for a toss.
Mm.
It's like a bolt from the blue, because real conceptions are there, which are not really the real conceptions. When
Right.
you see what you see in the movies, doesn't really happen.
No.
That's what we tell the patient. The can in the cancer means it can be cured. I mean, there's nothing about it which is fatal unless it goes to a particular stage, which is true for many other diseases.
Mm.
So that's not really an issue. And we can come out of it. There is no big deal in that. We can come out of it. And that's what we tell our patients. And what we do is we give pre and post counseling for the patients. And there is counseling by our stoma nurse, the ET.
Mm.
And this pre and post counseling is free for life.
Right. Okay.
And being in India, cost is a very big factor.
Right.
So as you know, we have to wear those bags
Mm.
lifelong we have to wear those bags. And 90% of those bags are imported.
Mm.
Very, very few. There's just two manufacturers in India. One makes a low grade material, one makes a medium grade material.
Right.
So we normally cannot trust them with the kind of adhesives that they use.
Mm.
So we normally use the imported bags. And what we do is we buy them in bulk based on the donations we receive. We buy them in bulk, and we sell it at cost. There is no
Right.
profit element in this. We sell it at cost. This
Right.
is what we're doing now. Our rates are among the cheapest in India in the moment, though I would believe that some government organizations may probably have got even lower than that. But then we have more than 300 varieties of items in our stores, which we can offer the patients.
Right.
And at
Right.
any point of time, it can be done.
Right. Okay. Uh, Sheetal, you had a question for Bincy at this point?
Yeah, I think going back to the psychosocial effects, my question was, do many people struggle with body image issues, Bincy, and is that worse for women? Especially, and I want to ask Mr. Uday the same question, if he agrees that if this is worse for men or is it worse for women?
I go ahead, Bincy.
Go ahead, no problem. So, first of all, thank you so much for having me, and I'm very happy to be part of this discussion. And Shraddha ma'am and Uday sir, thank you so much for sharing your cancer journey here, because it was really inspiring, and I know that it is going to heal many people who are going through this journey. So, and so coming to the question, so before I start, let me introduce what psycho-oncology is, because it's a new field in India. So like many people are not aware what psycho-oncology is. So psycho-oncology is a super specialty field within oncology that advocates patients and caregivers to overcome their emotional and psychosocial issues in their cancer journey. So coming back to the question, so yes, many cancer patients or and the survivors experience body image issues, and it also depends upon their type and area of the disease. So like from my past experience and during our discussion also, I have mentioned that I don't see a clear difference in terms of gender or age group. However, like few studies mention that male patients with an ostomy bag have more body image disturbance, and like the incidence rate of body image issues are high among young and overweight patients. So these are from the like scientific studies. But see, as we all know that like when there is a significant change in our body, the way we see ourselves, like like the base will the way we look at ourselves may drastically change. And a body image issue is like very common psychosocial issues for patients with cancer. And this has a strong implication for psychosocial adjustment as well as the social functioning with peers. This might be also largely associated with anxiety or depression. So like if the patient had a previous history of anxiety or depression, there's a chances of developing body image issues later after the surgery are high. So we need to like obviously address these concerns. So in our counseling, during our counseling, we always remind the patient that it is common to experience such feelings as a result of cancer, so that we will normalize it. And when we normalize these worries, it reduces the shame and embarrassment. And then after that we will check whether these body image like these specific concerns have related to body image, and finally with the consequences of body image difficulties. So we will address all these factors and how it is impacting their daily functioning. So we will address those things, and then we will counsel them. So during the counseling, so we will target their dysfunctional cognitions, emotions and behavior by altering their thought pattern, their thinking pattern. So we will help them to overcome in that way. So like body coming to the question itself, like it is a common problem, but we can't say whether it is higher among the male or female, because I have seen both in male and female patients are experiencing body image in our country. So that's what.
So there, do you agree?
Yeah, so like
To
both
some
gender.
Yeah, yeah.
to a large extent, I would say that body image issue is there among men, and mostly more than the image part of it. It has to do with the
The function.
visibility part of it, visibility or awareness part of it. Like for example, if you ask me, whenever I go for counseling to a patient, I tell the patient, "What are you worried about here?" You all know Hindi, na? Can I talk a bit
Yeah,
Hindi?
yeah, yeah. Sure, sure.
Yeah.
Please do. Please do.
So what I tell the patient is that finally you leave aside all the medical jargon, so keep it aside. What have they done in your body? इधर का कनेक्शन निकल के इधर दिया है, बाकी कुछ नहीं किया है.
Mm,
Thus, they have done a plumbing in your body. They have removed the connection from this place, like the plumber will do in your kitchen, and he has given here.
mm,
But since it is your body, there will be a lot of medical jargon associated with it. A lot of medical issues will be associated with it. That's it. There's nothing more than that. And I give them my own example. When they did the surgery with me, and I was shocked. They did the surgery, and the next day, the doctor comes and tells me, "Get up, you have to go for a walk."
mm,
So, holding 3 bags in my hand, I used to go for a walk in the hospital. And maybe it's different for me, I don't know. But then it was never an issue for me to come out of it, because I probably was not into it in the first place. I took it as every day as it comes. There is
right.
no big issue. I continued all my activities, including playing of cricket. I continued, though I
Mm,
wasn't diving around. I
mm,
stopped that part, but I was the wicket keeper, so I had to bend, and I used to bend. But when I
mm,
used to come home, if there is something fallen, I tell my son, "Will you pick it up for me?"
mm.
In the cricket field, I will bend and take the ball, no problem. It's all in the mind. It's all in the mind.
Right, right.
So
So
body,
did it affect your, and do you see it affecting life after urostomy, right? So I know you talked of whether you can bend or not, or what activities you can.
Obviously, there are some very obvious things that we have to go through. Like I used to tell my patients that suppose you had a fracture in your hand, you would have a plaster. That hand would be this way. Would you be sleeping on this hand? You won't be sleeping. You'll take care to that is this hand has not come in the middle of any of your activities. Here is the same thing. You have a stoma. They have given a connection here. Urine keeps coming. You have a bag attached to your body. When it fills, go and empty it. No big deal. You just go and empty it like you empty any other thing. You just empty it. And that's it. It's got a tap. Close the tap. Finished. When sleeping, you have to make little adjustments. Initially, you have to sleep like a mummy. But later on you can turn. There is no problem. It took me a lot of time to explain to people that life can be normal. You don't have to do 1, 2, 3, 4 things. Otherwise, life is normal. Eating habits, you don't have to do 1, 2, 3, 4. Otherwise, life is normal.
Right.
That's what I keep telling them. So normally what happens is, so many of my patients who are urostomy patients we used to get up 10 times in the night to empty their bag. They were never getting convinced that they can use the drain bag. Finally, most of them are now convinced that they have to use the drain bag. When I was undergoing my chemotherapy, I was very happy. They had connected the drain bag. I never had to get up from the bed. Whereas I see all the other patients getting up to the bed and going to the loo every now and then. I never had to get up. It was good draining out. So even now when I sleep in the night, no issues. I turn both sides, no issues. I was a sleeper on the stomach. That is something I can't do now. But otherwise, no. But body shaming, yes. If you talk of body shaming or for that matter, body image, especially among the younger males, they would not like to even tell that they are a cancer patient.
Correct.
So more than body imaging, I would think it's more of an awareness issue. I know of highly educated people who are HODs in some universities who are patients and who don't want to talk about it. So it becomes a little difficult to make them understand that there's nothing to feel ashamed about it. And most of the time what we feel is that if you talk to somebody in the West and tell them how to increase the awareness, they say, no, why are you worried? So go and stand on the road and show your bag and all of y'all and see how the crowd will come and they'll come to know. I can't do that in India, can I? It will be a spectacle if I do it in India.
So we need an equivalent of a Cancer Pride Day or something.
we do have Ostomy Day, but we are very bookish in India. We are very bookish in every matter. We are very bookish, and we would like to go by the book everywhere. It doesn't happen. So normally the main culprit in that is the location of the stoma. What you call stoma sighting. The location of the stoma is typically along the belt line. So when it is on the belt line, you can't put an insert easily. Of course, I have put insert. There is no problem. You can put insert, but then what happens is it protrudes slightly.
You'll get a bulge.
A slight bulge. So normally, if you are in a cold country, you put a coat on top. That's it. Then it no matter. But in India, you don't have that facility. So people normally put outshirt. Other than that, there's no big deal. I don't think there's an issue on that.
Right.
Most of the younger crowd feels a bit here and there, which anyway they will feel if they have short hair, they feel they want long hair. Same thing they'll feel here. So I wouldn't give it too much importance, but it is something they'll have to overcome. And I think with counseling, they can overcome that. I have seen quite a few of them overcoming it. So there's no big issue.
Right.
So I think you answered one of the questions that, a lot of people, when they see a patient or they see a bag, they have these questions and they want to come and ask, what is this? And and patients don't normally know how to deal with it or answer those questions.
So I tell you what, the levels of awareness in India, once again to go back to that, because that answers the question a bit, is so poor, so very poor, that in no government document the word ostomy is present. Even though it's such a major thing, it's not present anywhere in the government records. We are now running a campaign for declaring an ostomy patient as a disabled, so that at least with 75% of the patients coming from middle to lower middle class, At least they can avail the benefits.
Right.
So the awareness becomes an issue. But coming to your question, what was that question?
That how can patients deal with,
How can
questions?
patients dealing with it is basically based on what kind of counseling you get when you're in the hospital at the time of the operation, before the operation, after the operation, and subsequently once you get discharged, because it affects your day-to-day activities. No doubt it affects. You cannot use an Indian toilet. You cannot sit on the floor cross-legged. You can't do that. When you have a bath, you need to have an apron on. There is a plastic apron, nothing piece of cloth, a piece of plastic tight round. These are the things that you have to take. But more important is in the head. We get worried that this cancer is there. What will happen to us? He will say what will she say? If we are able to overcome these things now, no other issue will be as much of an issue as it is now.
What about loss of self-esteem? I'm sure that is another big issue and it's quite common as well.
Yeah. See, one of the side effects that are there prominently after you get the surgery done is it takes a toll on your cognitive abilities. It does take a toll on your cognitive abilities, but you are able to bounce back. It's not something you cannot bounce back from. You can bounce back. And I know of so many patients who have bounced back brilliantly without any issue. But yes, there was a time when they were very vulnerable. And those are the times when it is before the operation and immediately after the operation, and maybe a couple of months in normal life post-op. Otherwise, things are far better, far better. But yes, vulnerabilities are there. Definitely they are there. And they need to be addressed at the hospital more than anywhere else. When they diagnosed me, I never even knew what was ostomy. That tells the story.
Yeah, and I'm sure that's true for most patients.
True for most, and when we hold these camps, we hold camps in various geographies of the disease. You will be surprised to know that 9 out of 10 patients have not met another ostomy unless they have come to our camp. So that is how it is.
Right. Or if they have met, they don't know, right? Because nobody talks about it.
Nobody talks about it. Nobody talks, and no matter how much you tell them, they're not willing to open their mouth.
Right. Right. Bincy, on that, as a counselor, what is your advice to people struggling with self-esteem? You're on mute, Bincy.
So a lot of patients do experience low self-esteem. So there will be a lot of self-doubt, dislike of self will be there. So usually after cancer diagnosis or treatment or during the surgery, so if there is any permanent change in our body, so like he said, so or in the change in our functionality, so the way we see ourselves will gradually change, and it is completely normal to experience in that way. Okay, so 8 months before, I got a referral from the physician, and this patient had a problem with adjusting his work life. So even though he was managing it quite well initially, and he was changing the bag, and he was like totally independent, so he can do by himself, and there was no problem with the bag. But he had always had a problem meeting his superiors, as he because of a lot of self doubts, and because of that there was like poor self esteem was there. So also he always worried that about the possibility of others sensing the smell of his urine, and because of that he stopped meeting people, and also he felt awkward in meeting his superiors. So we need to understand, not only because of the stoma bag, there are a lot of other factors can trigger this situation. So like we counsel them, we sat with the patient, like it took like 2-3 months to help him to get over it. And also in a study it is found that like if a patient have poor adaptation, then we should be identified those patients before the surgery itself. So once we identify those patients, like we need to counsel them before the surgery, after the surgery and during the follow-up period. And also we need to identify whether these patients have any other psychiatric or any other issues related to the emotional aspects, whether they are experiencing any anxiety or depression. So like after that, what we do is we educate them and we empower them, so then we help them to embrace this normal. So during the counseling, we start with educating them so that they feel embraced, they feel like empowered with the necessary information. So here the stoma nurse also play a huge role. So she will also sit with us and she will educate the patient how to do and what to do and everything. And by that we will help them to embrace this normal. So considering such scenario, the counseling session will go through like a different stages. Okay, so for example, so it may be tackling the initial reaction. For some patients the initial reaction will be like very disappointed, like Shraddha mentioned. For some patient it will be shock, and so we need to help them to cope up with that emotion at first. So some patient might be in denial and they will minimize the significance of the event, and they try to avoid the reality of this like this situation. So for those patients we will help them to break those denial, and once that happened, the patients start to acknowledge it, and finally the patient adapt to the situation. And yes, of course, like he mentioned, it will take sometimes like months and years to accept this new thing. And but if you get a help from a mental health professional, so this time frame will reduce. So like these mental health professionals are trained to ease them into the treatment. So like by attending like getting help from these therapists, it will definitely improve their quality of life and the overall well-being also. So during the counseling we will try to identify their strength, their weakness, by looking at their personality, their belief system, like how they see themselves, the way they look at the world. So we will take all these important aspects and we help them to cope up in a much better way. And also attending a support group meeting, like he said, like we also usually get very rare patient. So so conducting a support group, like we find it very difficult. So actually if you have a lot of patients, then it would be better if we do a support group meeting so that we can learn from each other. So the first and foremost thing is, if you have any problem like physically, emotionally, be it psychologically, then they should definitely seek help. So seeking help from not only from the doctor but also from the counselor. So if you have a counselor in your hospital, in that particular hospital, it would be better if they go and meet the counselor, so that it will help them to cope up this, they will help them to cope up the situation in a much better way. And also like my advice will be like take one day at a time, because that really matters. So even though it will take some time to accept the situation and everything, so taking one day at a time definitely helps the patient.
Well,
Right.
let me add something here. Uh, in Ostomy India, all the counselors are survivors. We do not have, our members are all restricted to patients
Mm.
who have become survivors. So all our support groups are only survivors. So when you go for counseling, they know all the nitty-gritty details, which maybe the doctor will not be aware or the nurse will not be aware. But the nitty-gritty details, they will be able to tell the small nuances here and there. You have to put your leg like this, you have to put your hand like this, that will make it better for you, that will give you solace. So that is the biggest advantage if in the group people are survivors.
Right.
So
All the members are either colostomy, urostomy, or ileostomy patients.
Right. Right. Yeah. So I think that, yeah, that's exactly the our point always, that learning from lived experiences of people is always benefit. Although I think there is also a role for therapists, because sometimes people need more than just what other survivors will tell you as well. Just one question on how does it affect relationships and sexual relations, and even the feeling of sexuality. Any kind of
so like
see, do you want to go on that?
so many patients do have a lot of questions, like they will not tell in the initial sessions. In the first session they will not say, But like once we establish a proper relationship with the patient, they will start sharing their thoughts. Like some patients, they may say that I look different, I feel different, I don't feel like normal anymore, even though they have completed their treatment. Still they have lot many questions in their mind. And so usually what we do is we tell all our patients that all these feelings are completely normal. And I don't know why, like in our country, nobody is talking about the concerns related to the sexuality or relationship they are talking about, but when it comes to the intimate relation, not many people are talking about. And during the counseling, a lot of patients ask when can I have an intimate relationship with my partner again. Also they can check with their doctor also, but because this for that many factors could depend on that, okay, like their treatment, if they have fatigue or discomfort or pain, sometimes if they are physically exhausted. So along with that, other factors like adjustmental issues, if they have not acceptance, if there is not emotional support, so these factors also can trigger. So these things, these emotional and the physical thing are also equally important. And sometimes due to the cancer or due to its treatment, patients experience severe distress or depression or anxiety, and all these factors can have direct impact with their sexual desire. So basically it is important to have a healthy perspectively, not only in physically, psychologically and emotionally. So all these factors are really important. And there was a case, this patient, he is around 58 years old, underwent surgery and had completed his treatment. So during the follow-up, when he visited us, he said that there was no hope left for him. Like also he mentioned that they have not been having any intimate relationship and it is bothered him a lot. Okay. So because and after that we sat with his wife also, and we came to know that like during the counseling, the wife mentioned that they were not having intimate relationship because she thought it might going to hurt him. Okay, because he was actually, she was trying to protect him, but he thought that because of the treatment, because of the back, he was she's having a lot of distance, she's distancing from it. So therefore, like whatever like the problem is, the first and the foremost thing they have to do is, once they have to accept themselves. So having an open communication with your partner, and like you need to talk with them, so you need to sit with your partner and you need to discuss all these things, and you need to discover what aspects of an intimate relationship, okay, so what aspects of an intimate relationship important to you and to your partner. So once you share your all your feelings, your doubt, your fear, and also you have to listen to your partner as well. Okay, so that is very important. So sometimes your partner, like I said, no, they might be afraid because if they hurt you while you're having an intimate relationship. So please have an open communication, and if you find difficulty even after that, obviously you have to seek for help. So always that helps. So having an open communication and accepting yourselves and sharing all your fears, doubts with your partner always help. So
Right.
that's want to
Right.
share.
In fact, let me add, in fact, the role of the ET at post-op is extremely important in all these aspects, because the ET can really educate the patient in all aspects, because the ET is supposed to know all these things, and she will probably be able to educate the patient in all these things even as the patient has come out of the theater and he's not yet discharged. So she will have a role of looking at him every day. So when she's looking at him every day, this thing is something the ET can do, and the patient has got absolute trust on the ET. So that is where it all boils down to. The ET holds the key here, and that is very important. And
Sorry,
but
can I just clarify what is ET just for the audience?
yeah, sure. The ET is a enterostomal therapist, known as a stoma nurse for short,
Right.
and uh, and that is a specialized course that is there that the nurses have to take.
Hmm.
And there's only one institute in India which is offering that course, that's the Tatas in
Right.
Bombay.
Right. Right.
So they are educated on the variances and the various aspects of ostomy, and they know inside out almost as much as the doctor,
Right.
and
Right.
how to rehabilitate the patient, which most of the surgeons are not aware. These
Correct.
ETs will be aware because they also handle post-op.
Right. Right. And
So
are
in
they available? I mean, I know you said they provide this information before discharge, but often I think people kind of haven't thought through all the implications, right? So are they available
yeah, yeah.
later as well?
Yes, yes. In fact, in Ostomy India, we have an ET coming 2 times a week, and counseling sessions are free. So patients line up in queues and they get the counseling. So
Right.
there's not the ET counsels all this part, including the sexuality part. The ET will be able to counsel because they know what is what and where is where.
So right now, Ostomy India operates out of Bombay, right?
Yeah, we have our stoma clinic in Bombay, but we have branches in a few places.
Okay. So I think we had one question from Mr. Basu. I guess he's trying to address the financial cost, for patients from low and middle income countries. And I know you briefly mentioned it. It's a great challenge to undergo
Yeah,
urostomy.
yeah,
Is there ongoing cost as well as
yes,
one
yes,
time?
yes. I
Shraddha, I'm
can.
also going to bring you on again as panelist because I think we're getting into the Q&A, right, Sheetal? We have anything else?
No.
And yeah, sorry, go ahead, Uday.
The cost is India, so everywhere the cost matters. When you buy a car, you want to know what is the fuel, हम कितना देती है we say, isn't it?
Mm,
So we want to know the average. So at
mm,
every point of time, India is extremely price sensitive, and ostomy our products are nothing less. They are also
right,
extremely price sensitive. We have been trying to follow up with the government to waive off the GST on ostomy products because they are
mm,
life saving and they're
right.
needed for a lifetime. But then I have not succeeded so far. At least they have brought it down from 18% to 12%. So
Mm,
we are telling them to waive it off. So that effort is on at the moment. So, but then let me tell you, an ostomy appliance, when it is applied to put on the body, it has ideally supposed to last for about a week, maximum 8 to 9 days,
mm,
and then it needs to be changed, even if it doesn't leak, for hygiene purposes. But most of the time, during the summers, these bags leak every 2 or 3 days.
mm,
I have experienced it myself too. So then what happens is the ostomates end up changing their bags approximately. If you take an average, it works out around 75 times in a year.
right.
And each change will cost them nothing less than nearly 900 rupees. So we are talking about 70,000 rupees just for the bag.
Mm,
So we have put up 2 proposals to the government and told them that you have to bring this under price control if you are not able to remove the GST.
right.
It under price control. Like a stent, which used to cost a couple of lakhs, is now costing about 40-50,000.
Mm,
So bring it under price control. Let people take advantage of that.
right.
So with 75% of my members coming from those two categories of middle to lower middle class,
Mm,
it is very difficult. We have a couple of Indian bag manufacturers who manufacture bags which can be worn again and again.
mm,
But then what happens? The quality of plastic
quality.
the quality of plastic which they use is of thicker variety because it
Correct.
can be reused.
Correct.
Now this has an effect on the skin.
Mm,
The skin goes for a toss. So we
true.
really cannot recommend any such bag that they can be using. But then people opt for that. Many a
Mm,
time people opt for those bags. It's very unfortunate, but that's a fact.
right. Right. Okay. Shraddha, you had just as out of curiosity, and I guess for our audience as well, are the bags different for men and women, or
No,
are they
no,
the
no, no,
same?
no. Nothing,
Same.
nothing.
Okay.
They're the
They are
same.
same.
They're the same.
Okay. Okay.
The stoma is the same.
Right.
So I actually, during one of our support group meetings, we had invited one of the surgeons from Tata,
Mm,
and he had come and given a talk. So I had asked him a question as to why they are making the stoma along the belt lines.
mm,
Whether you have to wear a trouser, you have to wear it below that, or you have to wear it above that. It is so difficult.
mm-hmm.
Yes.
Exactly, वही line पे बना के रख देता है. So he did answer me, and then he only told me one thing: do you want to live or you want to wear pant? But
Yeah, those are the kind of standard kind of responses doctors give for questions like
Yeah.
that.
So I couldn't tell him anything.
Yeah, I had the same question because I cannot wear sari anymore. So I was like, "Arey, kahin thoda
नीचे
idhar
हो
udhar
जाता.
ho." Yeah. So I have to change my wardrobe. But I will just like to tell Uday, it's good to know a lot of things from you, lots of information. With my research, when I am in US, all the time I keep on researching on this dressing of ours, that wafer and bag, and there is something called half moon dressings, if you are aware of. So if I put, because my dressing lasts for 10 days, whichever season is it. So what I do, that I with the bag, and I do this semi-translucent tapes, and on tape I put those half moon dressings. So that keeps the bag in intact position for longer time, say 8 to 10 days, and even if I perspire, it stays there. But I cannot. I can only sleep on my right side for a while. If I sleep entire night, my dressing comes off.
No,
So
no, no.
now
You should not be sleeping whole night one place, यार. वो तो सिर्फ you do that only when you are not able to move, na. Even if you don't have a bag, when you sleep in the night, you keep tossing and turning a bit here and there, isn't it?
but I can't. And now, since
You
last
can
5 years, I am
you can do
sleeping
that.
in same position.
No, no, no. You can do that. You can do that. I'll tell you.
Whenever I have done it,
No.
it just comes off. It has
No,
been many times.
No, it's not like that.
It happens with me. I don't know what I'm doing.
I cannot judge for you or for anyone else. I can only judge for myself. Okay. So when you sleep, you should be able to determine which is the exact position beyond which is the danger point. So you should sleep as much as possible at that position. Like I sleep on both sides, but for many months I used to sleep only on one side. But now I sleep both sides. Even when I sleep both sides, I am very careful that the side on which the stoma is there, I don't sleep too much time on that side.
I don't dare on that side.
I come back this side. And you put a drain bag in the night?
Yeah.
You put a
every
drain
night.
bag.
So, even right now I'm having one.
Yeah. No, why are you wearing it in the daytime? Not needed.
No, right now, because I don't want to get up and go there and empty it.
No, I'll tell you something. All these all these manufacturers of these ostomy products, ना, वो गाड़ी को कैसा एक्सेसरी रहता है, वो मिरर रहता है, मिरर के पीछे स्टिकर रहता है, गाड़ी के पीछे इधर एक बम्पर को स्टिकर रहता है. They come out with 110 accessories. There is no need to buy any of those accessories.
Right.
Not needed at all.
I am with 2-3 things only minimum. But that half moon has given a real good shelf life to my dressing.
Very good.
So I am happy with that.
Finally, your satisfaction is mandatory, na? If you are satisfied, then you are your best judge.
Yeah, I'm really satisfied.
Absolutely.
But the sleep on right side, I will try now.
You should.
I will.
You should. And I heard you out when going abroad or traveling by air. I do not think you need a wheelchair. I have traveled so many times by air.
No, why I need wheelchair when I'm all by myself? Then I need wheelchair because I cannot carry things, and I don't want to. I don't want to get stressed. But if my husband or somebody is there with me, I just walk down, no problem.
I got into trouble only once when I took my entire kit in my carry-on, and they told the scissors you can't take. So
yes,
so remote the scissors
happens.
out.
Yes,
so now I put it in the check-in baggage now.
Right.
And once that security fellow held my bag and he said, "Ye kya hai?" I told him, "Isme urine hai." And he said, "Theek hai, jao." He didn't ask.
But it has not been that simple with me, especially when you are traveling through Middle East. Middle East, they don't understand, they don't listen. They are just take off, get out, like can't help it.
Fortunately, I didn't have that problem. When I've gone to Australia and once I've gone to Southeast Asia, I've not had those problems.
Yeah, sometimes I guess it depends on the airline airport and everything. So their lack
because
of
I
awareness.
travel to US, so I have to cross Middle East someday, either Doha or Dubai or something, and they are not understanding kind, so I don't take chance with them. I'm fine.
Right. Okay. So I'll just kind of ask our attendees if they have any other questions at this point. So if you have anything, I know that there've been a couple of comments, and I've just put out. I know there's only few on Zoom, but I'm still getting feedback. So if you can just fill out the form from the attendees. I think the feedbacks generally, Mr. Basu has been very. I think Shraddha, you should read them. Uh, but he's said a lot of positive things about your spirit and your experience. One question he had, which I am not sure, but whether we are the right people to answer. But if you have any thoughts on this, is there something like bladder transplant, and is that considered in these cases or not
No,
even
Yeah.
considered?
Yes, in
there
my
is
case, yes. Sorry, you want to continue? Go ahead.
no. What I wanted to say was there is a question of neobladder which has come up.
Right.
In the West, it is already there.
Mm,
It is there.
There's a neobladder. Two types of bladders are there. One is they put a neobladder in the place of your existing bladder.
right,
Second thing is they put a bladder just like you have a stoma outside. They put a bladder inside
right,
where a stoma is there.
right.
But from what I have come to know from the doctors is that there is the case to case they check, because there is a danger, because today a human bladder is such that it has got something called a non-returnable valve.
Mm,
So once the urine comes into it, it does not flow back into the kidney. Whereas
Correct.
whereas in the neobladder, they are unable to replicate this fact. They are
mm,
unable to replicate it. So in some cases, it has worked very well, but in some
mm.
cases, the urine starts to go upwards back. So they have to remove it. So neobladder has not been come out as a very good invention as of now, because they're still researching on it. And this
Okay.
bladder.
I was given that option
Mm,
because I was in 15, so I was given that option. But as he says, there are chances of failure. Like they said, there can be permanent leakage of urine,
Yeah,
mm,
that is why.
and you have to wear diapers for that. But
mm.
my doctor was very hopeful. My surgeon suggested me, and I took opinions from all over. But as he said, they were not 100% about it, and it is irreversible. Once
Mm,
you opt for neo, then this stoma process may not be feasible in all the patient is not practically done. So you choose and you suffer, or you
right,
just don't choose and go old school. And
right.
then I choose
The
the old
tried and
school.
tested. Yeah, the tried
Yeah.
and tested.
Do you know when was this first surgery that was conducted for bladder surgery in modern science? It's known as the ileal conduit. This
Mm,
surgery was conducted way back for the very first time in 1935.
right,
Ah,
right.
So now we are
We are getting to more
85,
than 85. Yeah.
85 years, we are still using the same technique.
Mm,
They're
same
not able
technique.
to come out anything. They're not able to come out of anything.
right. Okay. All right. I think we've had a great session, and I'm sure we've had people watching on Facebook as well. Um, but I think there still is not enough awareness about bladder cancer compared to some of the other cancers. But thank you for sharing, all three of you. Shraddha, took, you've explained your journey in great detail. Uday, you talked of your journey as well as the work that OAI does. Um, and Bincy for bringing in the perspective of counseling and psycho-oncology, which is, uh, not a well-known area still. So I think it is important that we had this conversation, and it will be up there in a few days, on YouTube as well. So we hope that people will continue to access this information, and I'm sure they will benefit from this conversation. So thank you so much. Thank you,
Can I
Shraddha.
say something?
Sure, sure, sure.
Aparna, I think this was only bladder, but
Hmm.
there is something called colon cancer.
Correct. We will.
Results in colostomy, and there is
Yes.
something called it's called ileostomy. So my request is if you could do similar sessions on these two as well,
Sure.
it would really give you a lot of difference. It will
Sure.
make a
Sure.
difference to the patients.
Yeah.
Yes, yes, we
No,
definitely
absolutely.
can.
Absolutely. We are
We'll also get
really.
more.
Sure. Go ahead, Bincy.
So, like, if you combine these three, you will get more viewers as well. So, if you combine colostomy, ileostomy, and urostomy,
Right.
then I think you will get more viewers as well.
Yeah, we thought whether we should combine, but we kind of felt that the journeys are slightly different. So we thought that
That's
we'd better do it separately.
Journeys are very different.
Yeah.
Journeys are very different, and colostomy, unfortunately, is there among the first 6 in the world. So
Correct.
we need
Correct.
to do that, and ileostomy is also highly prevalent in India. So that also needs to be done,
Okay.
and we'll participate in all of them.
Sure. Sure. Thanks.
Thank
We
you.
will be in touch to do more stuff together. And again,
Yeah.
once again, Shraddha, thank you. I think you kind of
Thank you.
you almost precipitated this webinar because when we heard your story and read it, we felt that we really needed to put kind of do this as a topic by itself. So thank you for inspiring us to cover bladder cancer as well. So
Thank
but yeah,
you all. Yeah. And would like to stay in touch with Uday. Would like
Any
to know
day.
more about it.
Any
And
day.
in case anything you want to do in Ahmedabad, would like to take over, no problem. We can help.
Hey, you have an ET in Ahmedabad, yeah? There is a very big ET in Ahmedabad.
Uh-huh.
Yeah.
I don't know.
Neelam
Uh,
Dave.
Not heard of her.
Ah.
Can you pass it on the contact number,
Of
please?
course, of course.
Please.
First I have to get
Please.
yours.
yeah, we'll figure. Sheetal will connect
Yeah,
and
Yeah.
we'll try to
establish
put
that.
up all the resources.
Yeah, no, I think that
definitely.
is, we definitely should put up. I don't think too many people are aware there about, the work that you guys are doing. So we definitely need to
Yes.
make that more
and
aware.
if you are doing some online support group meeting like in for patients, please let us know also so that because
Yeah,
I
now
know
we
few
will have,
patients.
because so far our support group meetings will be being held physically in parks, in hotels, chai pe charcha we used to call it, and we used to have them regularly. Now with this COVID situation, it has to be done remotely only. I don't think this option is available to do it physically.
Right.
So
Yeah.
we'll definitely involve you in that. There is no problem. You can participate and see for yourself how it is conducted and what are the real issues that are coming up from the patients,
Yeah.
directly from the patients. So you'll come to.
Correct. Yeah. Thanks, Uday.
No
Would
Thank
problem.
love
you,
to be
everyone.
part of that. Thank you, Shraddha. Thank you, Bincy. And thanks,
Thank you,
Sheetal.
everyone.
Thank you
And
all.
Bye.
thank you to the attendees for, listening in and joining in and participating. Thank you so much.
Yeah. Chalo.
Okay. All
Yeah.
right. Thank you.
Bye.
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 A nice meeting all of you all. Hope to
Yeah,
meet
same
again.
with us.
Yes.
Yeah, same here.